So some people are like, oh, everybody would die. Just leave me. This cholesterol thing. If you would die, would have died long ago. They make all those excuses and just not take care of themselves because they are not thinking about the quality of life. Yes, you die all right, but would you rather live healthy until that day, or would you want to be dependent on somebody? Your children who have to go to school, who have to take care of their own family. All right, so PAD stands for peripheral artery disease. And so going forward, then, what causes this disease? What causes this disease? And we'll go on to say that when your blood flow is reduced, basically what happens is when you have cholesterol deposits, again, going back to what we discussed last week, right? Cholesterol plaques that has formed as a result of accumulation of cholesterol, high cholesterol, the injury in your arteries, in the lining of your arteries, leading to infiltration of cholesterol particles and all the good stuff we discussed, right? When cholesterol has accumulated, I think it's a good time to show this video as we speak. When cholesterol has accumulated in your body, it has to find a place to land. And the places they land, because they are flowing through the bloodstream, flowing in the arteries, they are flowing through your pipes, they have to find places to deposit. And so what we are showing you now is cholesterol depositing the yellow substances that you can see over there. It's depositing that, and that deposit is what is going to cause a problem. And the problem is that it is going to narrow your artery. It's going to narrow your peripheral artery. So you see that for this image that we are seeing, the blood vessel is bulging out because of cholesterol accumulation. Now, this is actually not doing justice to it because it's going to push in. Like, this is actually a better picture. This is right in the middle of the way, as we can see right now. Right in the middle of the artery, you see that the yellow substance, which is the cholesterol plaques, have built up so much that now it's going to block the flow of blood into your muscle cells in your legs or your arms. And when that, if you again referring back to what we said last in our last show, when the flow of blood to your muscle cells become decreased, the muscle cells begin to suffer because they need energy, they need the food, they need the oxygen that the blood is carrying to be able to contract and relax. That is when you are exercising, when you are moving, and all those good stuff. So if your muscles cannot receive adequate blood supply because cholesterol, this yellow substance, is blocking the blood flow from reaching it, then we got a problem. My goodness. We got a problem. And that is what actually causes the pain in the legs, because your leg muscles need the supply of oxygen. But bad old, I won't say good old cholesterol. My goodness. But bad old cholesterol, our bad enemy cholesterol, high LDL, is hampering the flow of blood to your muscle cells. And so your muscle cells cannot do any work. This is why in peripheral artery disease, if you are resting, you don't feel any pain. But the moment you start walking or exercising, that's where the pain comes. Because now your muscles are looking for oxygen-rich blood so that it can contract with the energy and the food that the blood is supplying. But if it's no blood is coming because cholesterol is blocking the flow, then we got a problem.
Yes, so some people will have this pain so much so that when they are walking, they have to stop and sit because that's how much the pain, it hurts so bad. So the whole legs feel sometimes numb and crampy to the point that, as we are explaining, the cells are not getting the oxygen because the cholesterol plaques are blocking the artery. So as it blocks the artery, oxygen is not able to flow with the blood into the cells. That's why you get so tired and your leg hurts so bad because you're not receiving enough oxygen to the area.
And not receiving enough oxygen to the area. So she already went into the next point, which is the signs of peripheral artery disease or the leg pain we're talking about. First, of course, is the pain. We have already explained that. And also achiness. You may feel achy, in your muscles, muscle aches, especially in the regions of your legs and then your arms, but most of the time in the legs. And then also cramps. So if you have leg cramps all the time and you don't know what it is, don't stay home and think like, oh, it's old age. Yeah, old age could bring some cramps. In fact, electrolyte imbalance can bring cramps too.
Yeah.
But until that is told, until you've been diagnosed, you don't stay home and diagnose yourself and say that this is what I think it is. It could be this problem we're talking about. It could be blood flow problem because your blood is not flowing to your muscles the way they should be. And for that, your muscles are suffering. And that's why they are crying. And when they cry, you get a pain. My goodness. That's how the body works, right? If something is not going right, your brain will register as a pain.
You can say that their quality of life is really, really reduced.
My goodness.
Because of high
My goodness. The quality of life. That's why I hear the club. The quality of life, When we talk about health, it's not just the absence of disease. You don't feel like you're sick. Some people, the only time they feel that they are sick is when they are in a hospital bed and they can't do anything. But if you are not in a hospital bed, but you cannot walk, your quality of life is reduced. It's reduced no matter how young or how old you are. If because of peripheral artery disease, because of PAD, because of high cholesterol, my goodness, I should be quiet. Because of high cholesterol, you can't walk, you can't stand, you can't do exercise because you move 1, 2, 3, and you have to sit. Your quality of life is diminished. So much as we want to live long, we want that long life to be full of activity, being able to move around, visit family, play with the grandkids, and do all sorts of things. Not just live and be bedridden or live and you can't go anywhere.
And being so dependent on
being
people.
so dependent on people, So some people are like, oh, everybody would die. Just leave me. This cholesterol thing. If you would die, we would have done long ago. They make all those excuses and just not take care of themselves because they are not thinking about the quality of life. Yes, you die all right. But would you rather live healthy until that day, or would you want to be a dependent on somebody? Your children who have to go to school, who have to take care of their own family, because you're binging on cholesterol and the other things that cause high cholesterol, you become a burden to them. You are not going all right, but you could have made a better choice. So what are some of the risk factors? So we're going to talk about for this disease. Risk factors. I'll start. The first one is smoking. If you smoke, you are predisposed to leg pain due to high cholesterol. I know that peripheral artery disease may sound so hard. So you are predisposed to leg pain due to high cholesterol. And the next point there is another risk factor for that is high blood pressure. The HBP stands for high blood pressure. If your blood pressure is not controlled, you are at risk for peripheral artery disease or leg pain due to high cholesterol. And then the next one is atherosclerosis. Your arteries become narrow. So the tube, I think we should go back to that
picture again.
That picture that.
If you can.
If I can, this one. Yeah. So if this is happening in your arteries, then obviously it's going to lead to a complete slowdown of blood flow in your muscles, and that is where the pain comes from. So the yellow substance is what we call the atherosclerosis. The plaque has come, it's shiny, looking good like gold, but this is not gold, brothers. This is not money. This is danger. This is the only place that gold actually is not gold. My goodness.
And I think the other risk factor too is uncontrolled diabetes. You can be diabetic, but if you are able to control it, then your risk is reduced. So if you are diabetic, you have to find ways and means to control your sugar. And I think there is a test out there. People have test strips, they have machine that they test their sugar every morning. So if you realize that it's not being controlled, your chance of getting peripheral artery disease is very high. You have to talk to your doctor. You have to adjust your diet so that your diabetes is well controlled in order to reduce your risk of having PAD.
My goodness, that's well said. That's very well said. Honey, the other thing that I used to find interesting is that all of these risk factors, if you can control them, you're also protecting yourself from heart attack. You're protecting yourself from erectile dysfunction. You're protecting yourself from stroke. You're protecting yourself from any cardiovascular disease out there that we are talking about, because they work hand in hand. If you watched our show on, heart attack and stroke, this is the same process. And these are the same things that injure the lining of your arteries, So definitely watch out and make sure that you do the right things. The good thing is, if you want to do something, you always find a way. As Gifty said last time, where there's a will,
there is a
way. My goodness. So don't give up. Don't give up on your blood sugar. Don't say that I've taken all the medications out there and my sugar is still out of the woods. Well, there's another thing you can do. Just keep watching us. We're going to show you some other stuff, apart from the medications, which we will continue to ask you to take and consult with your doctor and your pharmacist to make the adjustments necessary to get to your numbers. We would say continue to do that. You don't stop, because sometimes I hear some people saying that as for my blood pressure, I've taken all medications and it's not stopping. So no. And some people too say that, the side effects of this medication, I can't take it, and they just stop and stay home. Do you know how many other thousands of medication that can be used to treat the same thing? If one is not working, what you got to do is to go talk to your physician, your APRN, your pharmacist, whoever is near you. Talk to them. They will figure out a different one that can be used for the same thing. That is the good thing about medicines. There's 1 in 1,000 for every one disease. If your blood pressure is not being controlled for whatever reason, your atenolol, your hydrochlorothiazide is not doing the job, you don't stop and stay home. You go and get a different one. Tell them, this is not working, or this is bothering me. Change it, and they will change it for you. There are always hundreds others, if not thousands, for one disease case. Of course, we have protocols that physicians follow. Take this first. If this doesn't work, you take that. So they always want to go that route. But that's why it is there. You have to follow the route. If this is not working, you take this other one. You don't stay home and give up.
The last but one is high cholesterol.
High cholesterol itself. My goodness, it's everywhere.
So having peripheral artery disease, one of the huge things is like if your cholesterol is high, then your chance of getting this disease is also high.
All right. So,
and I think the last risk factor is age.
The last risk factor is age. My goodness. Yeah. My goodness. Yeah. My goodness. So how can you reduce that risk factor?
Age. We are all aging, So age can be just a number if we do our things right. If our diet is good, we are exercising, we are doing all the good stuff.
According to the Centers for Disease Control in the US, age over 40 all the way to 60 is the highest risk, for developing PAD. As you age, right after 40 years, and it makes sense. By 40, you have eaten a lot of your pizzas, a lot of your burgers, cholesterol is there. So if you haven't watched your diet, at that point, the accumulation of plaques in your arteries would have begun. Right. It doesn't mean that you will have to reach there to see it. Some people, by nature of their diet and their genes, because they are making excess cholesterol, they may see symptoms of this even in their 30s or even their 20s. Some people are getting heart attacks and strokes in their 30s, gone too soon. You hear those all the time, right? So age is important. But like she said, lifestyle can renew your age. You can be 60 and somebody will look at you and say that you look 40, you look 50. It's because your lifestyle does not go with what the number said. And so in that respect, age becomes just a number. Beloved, we wish above all things that you prosper and be in health,
even
as
as
your
your
soul
soul
prospers.
prospers.
Thanks for watching.
Thank you.